Are you an entrepreneur or ready to become a boss? Welcome to Hawaii Boss, the business podcast made in Hawaii, where you will hear from island movers and shakers on who they are and their impact on our state. And now, step into the office of your host for Hawaii Boss, David Pettijohn.
Aloha, Hawaii Boss podcast crew listening in out there as you do every day, whether it's in the morning or driving home or listening as during your lunchtime. You know, we like to help you as you're chowing down, get into the boss's office. We want to find out what the bosses out there in Hawaii are thinking and how they're able to move things forward in this challenging economy with COVID and everything. And today we're fortunate to be in the boss's office virtually, the virtual boss's office with Vikram Acharya, and he's the CEO of Cloudwell Health, and which is a very forgive me, but before this, sir, I didn't know much about you, but this is a very impressive, the work that you do.
Thank you.
Vic, welcome.
Well, thank you, David. Aloha.
Sure.
Thanks for having me.
You bet, and we're excited to have you because describe your business for what it is you do. So as Cloudwell Health, it could be any number of things, but a telehealth arrangement that you've developed and it looks like perfected, but tell us a little bit about what it is you do.
Sure. So Cloudwell Health is a telemedicine service. It's pure, born and raised in Hawaii. So the co-founders, Dr. Chauhan and Dr. Strong, work and live in the state of Hawaii, and they saw just the significant barriers for people to receive care in the state of Hawaii. I mean, people were waiting months to see doctors, and we feel that we can do better than that. We want to be able to provide timely care, high quality care, compassionate care to the residents of the state in a manner that you can get it the same day. So whether it's urgent care needs, primary care, mental health, we're here to service residents of the state, and we're very, very happy that we've made it this far. We're very happy to provide for the state, and all telemedicine, all virtual, on demand.
And so that's interesting. You named off several sort of even to specialty level, which is very cool. You think, especially here, Hawaii healthcare, it's, the Straub group or the Queens group or the sort of, they're all vertically aligned that way. But this sort of seems out of the, outside of that, where it has the convenience. You don't have to step through all of the hoops sometimes and go to their physical location and that. What is the advantage of being able to do it virtually over, having to going someplace? And is it, are there some things that you can't do virtually?
Sure. So the biggest factor is really, number one, is access. So if you were to try and go to a brick and mortar primary care office, urgent care center, it could take months, to be seen.
Right.
And whereas with Cloudwell on a virtual platform, you could be seen the same day. So
even as a brand new patient.
Yeah. It's a brand new patient, and
it's a walk-in, virtual walk-in.
Yeah. In just a couple clicks, you have access to our clinical team, our clinical coordinators, all of whom work and live in the state.
Right.
So as soon as you book an appointment online, the coordinator will reach out to you. We'll make sure that you're comfortable with the process. We'll walk you through what to expect. Then a provider and you will have that virtual session, depending on your needs.
Sure.
And depending on what the next steps are, we can help guide you to the next level of care. So there are situations, to your point, where you may need to be seen in person. And if that's the case, our coordinators will help organize that for you. You may need to see a specialist, and in that case, our staff also organizes that for you. So it's a lot of nice, high-touch, compassionate customer service that goes along with the actual interaction. And, we know people are very busy, especially with the pandemic. People have a lot going on in their lives. So these are sessions that can be carried out whenever you want. It can happen early in the morning. It can happen late at night. It can even happen during a lunch hour. And so there's a significant convenience factor.
Sure.
What's also nice about the service is we take all the payers, insurance payers in the state of Hawaii. So Ohana Care, HMSA, UHA, United Healthcare, Cigna, and we're very proud of that,
Right.
including Hawaii Medicaid and Medicare.
Mm-hmm.
And so we believe that healthcare should be equal. Everyone
Right.
should have equal access to care, high quality care, and that's part of the cornerstone of our organization.
Mm-hmm.
Even those that want to pay out of pocket, we can organize that as well.
Sure.
And so it's equitable, high quality, and really accessible in an on-demand style. And so that's those are really the pillars of which the company is based on. Yeah.
Sure. Well, that virtual model, because of this COVID and different things, it's there's been this. It seems like it's allowed this opportunity to come about. Take us back a little bit as far as your company in Cloudwell before the pandemic, and were you as advanced as you are now with this model 3 years ago? Tell us a little bit about just the history of the company and how you've progressed and how COVID has kind of maybe put a bump in the road or helped you to better serve others. So give us a little history.
Sure. So about 3 years ago, Dr. Chauhan and Dr. Strong established a company called We Prescribe.
Mm-hmm.
And We Prescribe is a fee for service telemedicine platform.
Mm-hmm.
So virtual services are provided, but you pay a fee for it, which was outside of insurance. And then right before the COVID pandemic really came about, we were evolving. We knew that 98% of the residents in the state of Hawaii have health insurance.
Mm-hmm.
And so we have to deliver a product that's not only high quality and accessible, but also that accepts insurance. And
Sure.
so that was the evolution of what is now Cloudwell Health. So Cloudwell Health really opened its doors in January of 2021.
Okay.
That was the onset of the organization.
Mm-hmm.
And since then, it's really been very nice progression. The amount of patients that we're seeing, but most importantly, how satisfied the patients are. We
Mm-hmm.
have many patients, more than 50%, that if they receive services with us for the first time, they come back.
Mm-hmm.
And so in December of 2021, we knew that it was now time to launch virtual primary care.
Mm-hmm.
So previously it was urgent care and mental health, but the big one that where there's a huge need is primary care.
Mm-hmm.
And so right in December of 2021, we launched the virtual primary care program, which is great because through a virtual model, you can have primary care visits with us. And
Mm-hmm.
so we organize the steps before your appointment, during your appointment, and after your appointment.
Mm-hmm.
And so right now it can take months to see an in-person primary care doctor, but with us, it's the same day.
Mm-hmm.
And so it's
And
really
this is
been,
Hawaii wide, right? Hawaii. It's not dedicated only to Oahu because it's virtual and it's within the bounds of the state rules and regulations. The licensing, so
yeah.
it seems like it's good for all the islands.
Yeah, it's good across all the islands. All our doctors are Hawaii board certified.
Mm-hmm.
And what's great is when our patients interact with our team,
Mm-hmm.
they love the fact that everybody is from Hawaii.
Mm-hmm.
Sometimes you'll have telemedicine interactions on the national platforms where you could be in Hawaii, but your doctor could be in Maine.
Right.
It's hard to have that connection that
Right.
way. But with us, it's that your doctor works and lives in the state, and
Right.
so patients love that.
Right.
Patients love that, and it just creates a level of comfort, and that really drives the satisfaction and high quality care. Yeah.
And then you work through my chart for the communication and things like that. I think that's such a great tool that that's available here in Hawaii, and you can really do a lot of things without even having to see your doctor. Hey,
Yeah.
just send a note, and they know your history enough that they can negotiate the pharmacy or get a referral to pretty quickly. So that's helpful.
Yeah, we use the electronic medical record we use is called Elation.
Mm-hmm.
And Elation is a platform that's used quite a bit in the state of Hawaii.
Mm-hmm.
And so we're very proud to be partners with other providers that use that electronic medical record as well. It's better to communicate. It's easier that way. And like you said, for prescriptions and secondary levels of care, coordination, the electronic medical record makes it that much easier. And most importantly, it's what's best for the patient.
Right. The ability for all the wraparound healthcare providers are able to access this cloud-based HIPAA protected super locked, right, making sure that's never going to be penetrated ever, right. So that's our but it is it's as secure as it can be, and everybody can access that, and from the last visit they were at the doctor that may not even be related to you, so that you can really pull all that information together.
Yeah, yeah, everything is super encrypted, but the protocols are in place to facilitate communication of care and continuity. So
Right.
if there's secondary needs the patient has, our coordinators just do just a fantastic job of organizing everything, but also making sure that the patient is comfortable.
Right.
For many people, it's the first time they may have a telemedicine interaction. So the compassionate approach we use, the high touch approach we use is what
Mm-hmm.
people really like.
Right.
And it's delivered in a really customized local way. And that's what
Sure.
really generates the value for the patient.
So it's this it's an interesting your position is sort of it's a sort of a nexus between IT, healthcare, customer service, bringing all these resources together in this new way. Take us back to you. It seems like you have an interest in IT. Tell us about your background and how does someone enter into this pathway of work, but was there something antecedent to this in your, did you know in high school that you wanted to get into IT and healthcare? Tell us about, tell us about, maybe your first job, and then how you sort of, turn in these certain directions, or something that was pivotal there during that time.
Sure, sure. So I grew up in healthcare. So my father recently retired as a OBGYN physician. And
Okay.
when I was in high school, my job after school was I was a patient transporter.
Uh-huh.
And so I would transport patients from, their hospital bed to radiology, or from the ER to the pharmacy, for example, if they needed help.
Hmm.
And I just loved being in healthcare. And I
Right.
wanted to make a difference. I wanted to um, be a part of something where when people came and received services, they feel better about themselves and they've been healed. And
Uh-huh.
so that really triggered me to want to become a real leader in healthcare.
Hmm.
So for the past 15 years, I've served as a hospital leader across the country.
Hmm.
So I've worked as a director, vice president, and a CEO
Hmm.
at hospitals on the West Coast, in the Midwest, as well as the East Coast.
Sure.
So all that knowledge, all that acumen that I was able to gather over the
Uh-huh.
years really culminated into me wanting to pursue something where we could really challenge the status quo.
Sure.
We saw so many situations in the hospital where patients would wait sometimes days, to
Hmm.
receive care. And I always thought to myself, like, we can do better than this.
Hmm.
We can do better than this. Patients should not have to wait so long for care. And
Right.
so um, I've connected, and just wonderful opportunity to connect with the founders, Dr. Chauhan and Dr. Strong. They articulated the vision
Uh-huh.
of where they wanted Cloudwell to go. Um, and we felt that this would be a great match.
Right.
Their knowledge compared in combination with my knowledge, my
Hmm.
experience, and we thought that this could be a great fit.
Hmm.
And so, you know, it's been great so far.
Right.
Plotting out our strategy. How do we take great care of patients?
Uh-huh.
How do we look to expand our
Hmm.
services? Um, how do we make sure that we're delivering great care? How do
Right.
we make sure our IT is working? How do we
Right.
manage our finances? It's the things I did in a hospital, but it's, to me, you're challenging the status quo. You're
Hmm.
delivering better care, more timely care, and that's ultimately what gets me very excited about this. Is
Hmm.
that now we have an opportunity to make care better. for people in the state of Hawaii, and we're providing a service that everyone can access too. It's not limited. And so, yeah, it's been a kind of an interesting journey from transporting patients to Cloudwell, but
Right.
all those experiences that I've gathered along the way really helped a lot for me to get here and ultimately try and make a difference with Cloudwell and help advance patient care.
Sure. And so, did you find that you had to adjust your pace? You mentioned all of the places that you've worked as you've arrived in Hawaii, and while it's virtual, you don't have to go to a physical location. Is there some things that you wish you would move a little faster?
If anything, I've appreciated the people.
Uh-huh.
I've been able to really establish warm relationships, great relationships with people in the state of Hawaii, and I'm very grateful because our entire team works and lives in the state. And so I've not only learned, but I've appreciated just the contributions that they make.
Right.
And so, and it's the great stories are when patients tell us how wonderful the care is, how
Right.
compassionate our team is.
Uh-huh.
And the team is all from the state. And
Right.
so when we have those kind of stories, it's not about the pace for me. It's about making sure we're taking great care of patients every day. So I've been enjoying every minute of it.
Sure. And now, uh, these pathways of communicating with folks and again that high touch type of thing requires a bit of design in IT. Now, is that your background, or is there a do you collaborate with other people, or are there things that are just on market that just work? We don't want to give any secrets away of how you do things, but how do you go through that process of selecting? This is going to provide the best. This is the backbone of what we do, the IT part. How does this? How can we make it better and even more accessible to folks? So how do you see that going forward?
Sure. So when we were assessing electronic medical records, we knew we wanted to be able to have a record that not only is functional for clinical care, but something that can translate amongst providers in the state of Hawaii.
Mm-hmm.
That was a very critical component for us. And Elation was a great tool because it's something that's used heavily in the state as electronic medical record.
Mm-hmm.
There is Epic, but Elation is used just as much.
Mm-hmm.
And so that was a key component. But what we did was over time, we have found people, some of whom that I've worked with in the past, that have been able to help us roll out that electronic medical record system for Cloudwell.
Mm-hmm.
So some of these past experiences I had
Right.
ended up becoming very helpful because these are some of the individuals that are working with us now.
It is about those relationships because there's not a whole bunch of people in the world that know how to do that certain type of that medical record and how to to roll it out in that specific office all online and those type of things that would have that ability to do that. So is it easy for the doctors to make that bridge? Sometimes the doctors don't like the medical records as much as it seems like they're much more savvy now. What do you think?
Yeah, it's the providers have been great. The transition to Elation has been seamless.
Mm-hmm.
Everybody was been great to work with. The transition process, thanks to our team, went really well.
Mm-hmm.
And so normally these type of transitions can take 6 months,
Mm-hmm.
but we were able to make this transition in a much shorter time frame.
Uh-huh.
It really comes down to the people.
Mm-hmm.
You really got to make sure you hire the right people, make sure that they work well with the team members. And we were very fortunate enough to have the right people.
Sure.
Who are very dedicated and who just deliver a great product.
Well, let's explore that some more. How is this? There's staffing crunch going on too, with all of the clinical staff sort of sucked up into the the COVID testing apparatus that's taken over. But are you hiring? You're talking about growth. Is that something that how do they find out if there's jobs working with you guys as you're moving forward?
Yeah, and we're definitely looking to hire. We want to bring on more providers. We want to bring on more staff.
Mm-hmm.
as we grow, you obviously have to find the right team members to help as we build.
Mm-hmm.
And so, yeah,
So you're talking like physician extenders, like physician's assistants and nurse practitioners.
yeah.
Okay.
So we have physicians, but we also have nurse practitioners
Mm-hmm.
as well. We have therapists
Mm-hmm.
for our mental health program.
Okay, like licensed clinical social workers and
Mhm.
or okay,
Yeah, we have a psychologist,
okay,
part of the team, and
okay.
so we run the gamut,
Mm-hmm.
and we also have clinical coordinators. These are individuals who really play a pivotal role in organizing the patient's care, communicating with the patient,
Mm-hmm.
uh, setting up any next steps that need to take place to provide care for the patient. So
Mm-hmm.
it's just a really great team. That's one of the areas I'm very grateful for is the compassion and approach that residents of the state take when it comes to patient care. I mean, it's just done in such a warm way,
Uh-huh.
um, warm and patient,
Uh-huh.
and in a manner that it's just beautiful to see.
Right. And now I imagine again, I'm looking back, you said again, your father, OBGYN doc and growing up with that, was there an expectation, curious sometimes, did, dad want Vic to grow up and want to be a doctor, or is that, was that on the table? How did, how does that work? How does that work for in your family? Everyone's trying to figure out, if can they cut their own path, or they have to, how do we address mom and dad's wants as we're trying to make decisions?
Mom and dad um, obviously wanted me to be hardworking, humble, and respectful. But when it came to career decisions, they were like, you pursue what makes you happy. You
Sure.
know, we'll provide you everything we can, but if you find something that you really like,
Mm-hmm.
go for it. And
Right.
so for me, once I was in the hospital and I had a chance to see that you can lead these organizations,
Mm-hmm.
you can lead departments, you can lead enterprises and bring teams together.
Mm-hmm.
Like, in the hospital, you have physicians, environmental services, food services, radiology,
Mm-hmm.
and everybody has to come together for a common goal.
Mm-hmm.
Is really taking great care of patients.
Mm-hmm.
Sometimes people look at it differently, right? Needs are different, assessments are different. So as a leader of the enterprise, you have to find a way to drive consensus,
Mm-hmm.
set goals and drive consensus. And so that was always a passion of
Mm-hmm.
mine. How can we all come together as a team and take better care of people? I always wanted to do that.
Right.
And the chance that I have now to do it with Cloudwell,
Uh-huh.
where we're challenging the status quo and delivering great care
Mm-hmm.
where patients don't have to wait. I mean, that's golden to me.
Right.
That's
Well, again, you have all of the ideas and things, but as a practical matter and as a leader, how do you set that strategy? Okay, what's the first thing? This first quarter, I'm going to work on this. Next quarter, how do you budget your time and resources? Again, not necessarily specifically for you, but what's the process look like for you?
Sure. So we have pretty significant amount of strategic planning that we do. So for example, in 2021, we started looking at our goals for 2022. Right?
Mm-hmm.
Uh, how many patients do we want to see? What's our budget? Um, what are our growth rates month over month?
Mm-hmm.
What are some new areas that we may potentially want to scale in?
Mm-hmm.
What are new programs that we want to launch? Those are all go through a very formalized planning process
Mm-hmm.
that we do as a team. And so part of the CEO's job is to develop these plans, vet the plans with the co-founders,
Mm-hmm.
set the targets, and then work with the team to execute. And so there's a lot of detailed planning behind the scenes,
Right.
outside of behind the patient care, so to speak, that takes place.
Right.
But once you set your plans, it's kind of like plan your plan, work your plan, right?
Sure.
We know the direction that we want to go, and now we're in the process of working the plan.
Right. So how did you learn that? Some people get it from again growing up, and they learn certain things by watching. Some get education. For healthcare and certainly healthcare executives like yourself, and people thinking out there, well, maybe I don't want to be a doctor, but I still want to be in healthcare because they have this affinity. Sometimes it just that same thing happened for me. You just catch this bug. It's like, okay, I want to be a part of this, whatever this is. And so again, what kind of education or what kind of path should they be looking at? And I know people come up from all kinds of different ways, but maybe the standard path, or maybe what you're recommending or seeing as the best path, and paths of study to help be successful in this line of work.
And there's really no kind of one straight path towards running hospitals and being a health system leader. My path is such that in college I was a health administration major, and then I pursued my master's in public health in hospitals, and then I did my MBA, all with a focus on healthcare. And
Okay.
I just kind of worked my way up over the years from manager to CEO. That's the more kind of traditional route, if you want to call it that, where if you're not a clinician, you can take that more traditional path to become a hospital or health system leader. There's physicians that maybe start their career as physicians and then go into management. There's nurses who may start as nurses,
Right.
go into executive leadership. So there's multiple paths you can take.
Therapists, depending upon, because each of them, there's different fields even within the hospital.
Yeah. There's therapists, physical therapists, pharmacists, anyone who really has a desire to pursue leadership, that wants to really lead a department or lead multiple departments and bring people together ultimately to deliver better care. It was, to me, the focus that I've always had throughout my career, no matter what role it was, making sure we take great care of patients. That's our job. If we've done our job, everything else will follow. That's what my mentor told me a long time ago. Like, if we do right by the patient, everything else can be okay. And no matter what the role has been, I've seen that. Absolutely.
Yeah, the patient get taken care of first. If you put the quality first, all the other stuff falls in line. The revenue and the staff who are engaged in helping, because they know that they're delivering a good product, so they're engaged, and it's powerful when you get to sort of create it and start it from scratch.
Yeah.
How is that different from walking into something that's already going? Tell us about how that was. Kind of what's the first thing you have to do when you're starting up something new?
Yeah. So it was a big change going from hospital administration to being part of Cloudwell. That was a very significant transition. However, a lot of it was in the beginning just learning. You're spending time with your team, participating in the conversations, discussing where are we, how does the platform function for you, where do you see the challenges, where
And you
can
never have any disagreements?
we have disagreements.
Oh, good. Someone said that that's a healthy thing. How is a disagreement healthy? I don't know.
Yeah, I mean, having a disagreement means that it's not a personal. It's not done personally. It's
Right.
What's the best product? What's the best step that we need to take? And if you didn't vet it, if you're trying to get to the best result, but there's some disagreements along the way, that's okay.
Right.
That's okay, because you're trying to get the best product. If the team members all know that this is not a personal discussion, but this is best for Cloudwell, then that's okay.
Right.
Because in the end, you're trying to generate the best possible result. And so, there's, any type of organization, there's going to be ups and downs, there's going to be disagreements, there's going to be some things that blindside you, but our biggest thing is let's just stay focused. We have our plan, we have our goals, we know what our mission is. Let's just stick to that. If we stick to that, we can get through these unforeseen type of things that may come up.
Right, because it helps, if you're focusing on that goal out there, the current maybe little obstacle in front of you is, okay, I can see the goal, so now I can do a quick fix to move around this thing, and then we can keep going, keep on trucking to where we're trying to go. But if places lose that vision sometimes, sometimes everyone needs a reminder, or as long as everyone knows the vision and shares it, then even when someone's down a little bit, the other person can, continue to strive and push that vision along with everyone
Exactly.
else.
Exactly. And just showing, appreciation
Mm-hmm.
um, to our team who take care of the patients every day.
Mm-hmm.
That um, we appreciate what they do. It's hard, it's just very difficult.
Mm-hmm.
So it's important to show that as a leader, show appreciation to your team.
Mm-hmm.
That thank you for everything that you're doing, taking great care of patients. Because without them, we don't have Cloudwell. And so
That's
that
right.
respect and that appreciation has to be authentic.
Mm-hmm.
It has to be genuine. Um, people are going to know if you're faking it.
Mm-hmm.
You have to be sincere. And if you show that loop back that you care,
Mm-hmm.
I believe that the happier your team is, the better care patients receive.
Right.
That's always been the adage in the hospitals is like happy employees, happy patients, and it's no
Right.
different in Cloudwell.
So how do you measure that? Again, it's a science, healthcare administration, and all your training. I'm sure you had to write a few papers. There's a scientific approach to the things that you do. Working with folks. There's some backing for that. So, I mean, as far as for you, what did you think it was going to be this technical when you were coming into it that you'd have to sort of juggle all these different things?
Yeah, my mentor, he told me years ago um, that in the end, management and leadership in a hospital in a healthcare setting like Cloudwell is people taking care of people.
Mm-hmm.
We're here to take care of our people, meaning our team. We're also here to take care of the patient. So a lot of it is, as when we talk to team members, how are you doing?
Mm-hmm.
How are you feeling? Do you have what you need?
Mm-hmm.
We're communicating with you in a way that is clear.
Mm-hmm.
You have the resources needed to do your job,
Right.
do it well. And so it's more of like it's approached in with humility.
Right.
I'm here to make sure you can take care of patients.
Right.
That's my job, and so that's how I approach it,
Uh-huh.
because ultimately it's about making sure that people can take great care of patients. And if I've done that, then maybe we've done something right.
Right.
So, yeah.
And it's harder now too because used to go we'd get down at the office and we'd go have hey, it's someone's birthday, we'd celebrate and get together, and so virtually making sure that people are a phone call goes a long way. We've
Hmm.
forgotten that phone calls are maybe some of the most intimate ways that you can communicate with someone.
Yeah.
Right.
Part of so I do a lot of mentoring of hospital administration, healthcare administration students.
Mm-hmm.
That's what I always tell them. Is that, I know times are, especially right now with the pandemic, things are very challenging, but never forget the value of a phone call.
Mm-hmm.
Pick up the phone and just talk to somebody on the phone.
Right.
And better yet, if you're in a hospital, go to the department and talk face to face.
Mm-hmm.
You can convey so much better. The conversation can be so much more productive if
Right.
you do it that way. Because also leaders have to be mindful that there's different generations, and different generations have different ways of communicating. And
Mm-hmm.
so if you really want to convey things the best you can, a lot of times it's best to, right now at least, pick up the phone, and if you can, talk face to face.
Right. And do a lot of listening.
Do a lot of listening, a lot of listening. I always, I've always viewed it that, you know, I'm not a clinician. I have to listen to what the clinicians need to do their job. I have to listen to what our administrative staff need to do their job and supply them with the resources they need to be successful.
Mm-hmm.
Um, and so that's kind of how I've always approached it. With Cloudwell, it's no different. Just creating an infrastructure and a plan so that we can take great care of the patients. And that's the, if you approach it that way, I find that people will really appreciate that.
Mm-hmm.
That you're not the heavy-handed CEO who's going to act like they have all the knowledge and they know
Right.
everything. You can't do that. Like you have to have humility. You have to be compassionate, be empathetic, especially right
Right.
now, and listen.
Yeah, walk for a mile in someone else's shoes,
Mhm.
and have so you can have a little empathy and a little, so that they can also see that you're hearing them, or that they have, a listening ear. Yeah, someone
Mhm.
hears me. Hey, he listens to me. Whether you can fix it or not.
Yeah,
Just acknowledging it.
yeah, and just be. Yeah, sometimes at first it can be, people may not be as talkative in round tables, but over time, when they know that you're sincere, they're just like, hey, let's have a conversation. We could talk about what's on your mind.
Right.
How are you doing? And the more you do that, you demonstrate the consistency and authenticity,
Hmm.
and people will really feel like, hey, um, he really cares. He really cares about us, and
Right.
it's not just me working for Cloudwell, but me as a human being.
Right.
And those are the things that you got to make people believe in what you're doing. Yeah.
Right. And I think you're using that approach. It sounds like for both your own staff, and then the high touch model for all of your patients, that you're
Yeah.
you're trying to wrap your hearts around, and sort of that comfort, and give them that that guidance that they need. So it feels like a great company, just from the vibe I'm getting from you. And so
Mhm.
we'd and this opportunity for folks in Hawaii to have easy access. And so the best way to get a hold and see is just look up. I was really easy. I could find everything on Cloudwell Health
Yeah.
dot is it .com? I can't recall if it is or
Mhm.
not, but
Yeah.
yeah. So I mean, look it up, and also saw that there's also maybe some development with some other maybe small equipment that there's to be able to use as a monitor for folks in their home. It's maybe a one-stop sort of vitals monitor. It looks like potentially for folks. And are you deploying something like that out in the community?
Yeah. We're so with the virtual primary care, we're trying to find you know more and more ways to improve the care model, the care
Mm-hmm.
delivery program. And so, yeah, we have some ideas that we feel can really benefit residents of the state of Hawaii.
Mm-hmm.
And so, we're deploying some tools, but it really starts with that first interaction.
Right.
If a patient comes to Cloudwell because they're sick
Mm-hmm.
and they need to be seen, or for mental health needs,
Mm-hmm.
if that first interaction goes well, they're going to come back.
Right.
And it really starts with that.
Mm-hmm.
It's just one patient at a time, compassionate care, one patient at a time, and we see that. We see patients who, and that was the reason why we wanted to do primary care,
Mm-hmm.
was to address the shortage in the state of Hawaii of primary care physicians.
Mm-hmm.
But also, many of our patients wanted us to become their primary care physician.
Mm-hmm.
So, in response to that, we decided to pursue it. And I'm just really happy that we did,
Right.
because we're now developing deeper relationships with our patients,
Mm-hmm.
where we can take care of a variety of different things that they may have.
Mm-hmm.
And if they like it, they'll tell others, and others will come to and receive great care as well, great quality.
Mm-hmm.
So
Yeah.
it's an
Well,
exciting.
it does. It helps. It sort of fills in the niche of the needs of Hawaii's sort of diverse healthcare environment, and I think there's lots of opportunity for more of that sort of creative, IT driven, um, you know, uh, resource to the healthcare community, or the government, or the state, and other state needs as far as healthcare. And so
Mhm.
really in a great position to do that. It's just a matter of having enough people, it sounds like. And but it sounds like the vision is clear, and you guys are moving forward. So we're excited for you, Vic, and your team. But
Thank
we
you.
always want know a little bit more about. You've lived all over the place, and what made you finally decide, Hawaii is it. And when you're not, uh, making sure everything's smooth over where you're at, where do we find you? You out in the water? Are you up on the mountains? What are you up to?
Yeah, for me, the love for Hawaii really is with the people.
Mm-hmm.
I'm from the Midwest, but I've worked across the country. But the people of the state of Hawaii are just beautiful people.
Mm-hmm.
Just the way relationships, everything is built off relationships. It's you have to cultivate a relationship, and once that relationship is there, it's very solid. It's very solid.
Sure.
It's more than just a business interaction. It's a
It
personal
takes time.
interaction.
Yeah.
Yeah.
Yeah, it's not a vertically sort of like, okay, you're this big boss, you're this. It's not a vertical
Mhm.
relationship. It's a very much sort of a horizontal relationship with the group of people that you know and the group of people that I know,
Yeah.
and how they all sort of integrate and what business we do together. And yeah, it's
Yeah.
very yeah, refreshing, right?
It's very refreshing. And once those relationships are intact, you can really do some really great things
Hmm.
because it's because you know each other so well, and so, in the big enterprises, you can get lost.
A
You're just out
number.
there. Yeah, you're
Hmm.
just a number. But when working with Cloudwell in Hawaii, everything is done on such an intimate level
Hmm.
that I absolutely love it. I really do. I have three little ones, so my day is always
Uh-huh.
it's pretty busy. My oldest is 9, my middle guy is 6, and my baby, she's 2. So things keep me pretty
Wow.
busy. I'm on the
Don't
run a
blink, don't blink, my brother. Uh, it goes fast, but that sounds like a fun time, especially here in Hawaii with so many things to do and be out in the water and the outside, and it's really a wonderful lifestyle. And do you do much, again, wrestling those guys? Are there sports and things like that? As some families get right into that.
Yeah, I've been a big sports fan ever since I was a kid.
Uh huh.
I play a lot of tennis, so
Okay.
I love playing tennis. I'm a huge football fan.
Uh
I
huh.
just and my Las Vegas Raiders actually made it into the playoffs. I couldn't believe it, and so
Yeah, they're playing the Bengals, right?
yeah,
Wild card game.
yeah,
Yeah, that's going to be a tough one. They both sort of a surprise this year, right? Both teams.
yeah, yeah. They somehow got in, and so
Uh huh.
I've been a Raider fan ever since, well, you know, 30 years, and
Right.
so hopefully we have a chance to compete tomorrow. So we'll see. But yeah,
Awesome.
I love
Awesome.
sports, love being outside, getting my kids in tennis, getting them into swimming and things. And so,
Yeah.
I'm pretty busy outside of Cloudwell, just trying uh, keep things going the best I can.
Right.
So
Right. Well, hey, it's tough, when you're dealing with these complicated things and then having some work-life balance. Again, if you're going to work and you have to sort of slave away, that's been my opinion. Why not get to Hawaii a little bit so that
yeah,
when you do have downtime, you can get immediate sort of a refreshing sort of a sunshine blast and then even though if you can just spare a little time, you can still get some great refreshing again views or a little breeze on your face.
oh yeah,
Hmm.
yeah. I mean, there's coming from, yeah, I lived in the city of Chicago, but out in
No
Hawaii,
thanks.
it's just majestic. I mean,
Right.
and so um, it's just it's been a totally different dynamic for me, a totally different place. But I've enjoyed every minute of it. I've told the team I wouldn't want to be doing anything else.
Awesome.
I really enjoy it that much, and like you just develop these relationships, and then when you develop the relationships, it translates into great care, and that the residents of the state have a great resource if they
Right.
need it. And so, within a few clicks, you have access to medical care.
Right.
And especially with, unfortunately, because of the pandemic, we know how much mental health is a significant need.
Hmm.
We have that too. So a lot of times people just want someone to talk to, and
Right.
to know that we can offer that
Hmm.
with compassion, knowing that the team is all from the state. It's just really great. It's a great product.
Yeah, a lot of times people they need help, they want help, but they don't know how to navigate through the system. They
Yeah,
do I call the number on the back of my Blue Cross Blue Shield I can't read, and then I got to get online to find which doctor, and
yeah,
it's sometimes a difficult process, and then they go without the care. But it sounds like if they just with your insurance information, you can tell them if what's covered and what's not, and
yeah,
make things happen right
yeah,
away.
yeah. Our coordinators, they'll once the appointment is booked, they'll reach out to you. They'll walk you through what to expect,
Hmm.
and yeah, in the same day, you have access to care.
Hmm.
And it's just really simple and easy to use, but also very high quality. And so, It's been a great journey so far, and we're just going to keep playing. It's just been great.
Awesome.
So.
Well, hey, hopefully you don't have to work Saturdays. You can get out there on the tennis court and make some things move within the bounds. And heard pickleball is a new thing that's coming up. Some people are saying, raving about pickleball. I don't know.
Yeah, it's becoming pretty popular. Tomorrow we're celebrating my son's birthday. So he's a little guy, so he loves Batman. So it's gonna be a big Batman theme.
Nice. Well, hey, it sounds like you're winning on a whole bunch of levels and enjoying your time here, and hopefully we'll see you again on the Hawaii Boss. So we can get the great update when you've achieved all your goals for 2022. We'd love to hear how things turn out for you, Vic, and for CloudwellHealth.com, and get on there and sign up and talk to someone right now.
You got it. Thanks a lot, David. Thanks for having me. I really enjoyed it. Appreciate it.
Yeah, thank you, Vic. Yeah, take care of things.
Thank you.
Stay safe.
Take care. You too.
Make sure to subscribe to Hawaii Boss and follow us on social media at Hawaii Boss Podcast at the links in the description. We'll see you soon in the boss's office.